Waves are eternal. They are caused by the moon's pull on our planet, this celestial rhythm that squeezes and stretches the air, creating motion, creating life. You can make waves simply by throwing a stone into a lake. The ripples move outward from the center, magnified 100, 300 times that initial drop. In science, in medicine, a patient walking into our doors creates ripples. When a family hears a difficult diagnosis, their world changes instantly. It is the initial drop, the single powerful stone that disrupts everything. What follows is a journey that connects science, care, and compassion, all focused on one individual. It is here in Minnesota that the greatest journey of discovery begins.
When patients first hear that diagnosis of a brain tumor, they seem scared. They're not sure what it means. They bring with them, all different kinds of emotions around that diagnosis and really a lot of hope.
And we kind of have to take a huge step back and start from the beginning and understand what they understand about what's happening, fill in gaps, and then kind of explain what the future looks like.
And so the goals of what we do are really to make them comfortable and make them have the best quality of life they can while they have their disease.
So literally, if you sit down and you watch television, you'll see an immunotherapy commercial. So many patients, and I'd say it's not perfect, there's a lot of people that immunotherapy doesn't work for, but there are groups of cancers that just haven't seen as much success as things like melanoma, lung cancer, where immunotherapy has really become a very important component of care. One of these are brain tumors. Even our best treatments, they don't work, and we have to do better.
At the University of Minnesota Medical School, we have an unbreakable belief that science saves lives. It is not a solitary effort. It is team science. Our physician scientists like Dr. Sloan and Dr. Terzakis work at the intersection of the scientific frontier and the clinical frontline. They are driven by an essential question to understand why some patients respond to treatment and others do not. This search for truth is the engine of our academic mission.
I collaborate with Dr. Sloan in trying to investigate innovative ways to treat brain tumors, and brain tumors in both kids as well as in adults. It sort of starts with the patient walking through the door. You get a sense of who they are as a person, their family support, their family circumstances, the tumor diagnosis, the biology of the tumor, and you kind of put that all together to try to figure out, what is the best treatment for that particular patient or that particular child. And so I think collaborations with someone like Dr. Sloan, we're able to sort of take what she's learning in the lab, and then we can say, okay, well, this is maybe our general treatment recommendation, but we're going to make some adjustments to tailor it so that it's just right for that person.
We know the immune system has a very important role in sometimes promoting cancer, sometimes fighting it. So Dr. Terzakis and I have a clinical trial where we're collecting these blood samples from patients. If we can see patterns of our patients that are receiving radiation, that potentially we can see areas where we can intervene to make the immune system even better.
And then go back to the patient and say, okay, can we tailor your treatment to take into account how your individual immune system is going to respond to the therapy?
The knowledge gained from one patient's journey must become the cure for the next. This is why research and clinical trials are so vital. They are the mechanisms that allow care to evolve. It's iterative and it's hard, but it is how medicine advances. One patient, one discovery, one moment of courage at a time.
I think at the heart of academic medicine is, we just don't accept the status quo. And so there's always this drive for innovation. There's always this underpinning of curiosity. Can we do better? How can we do better? To be able to do that, it does take a village. We're in it for our patients. We are here because we have the drive to continue to do better. It's that curiosity to figure out with research, how can we evolve better treatments for our patients? And so it's a really amazing collaborative environment because of that. Teaching is one of the most rewarding parts of my career, and my role as a faculty member, but also knowing that kind of the future of oncology is going to be in these great hands with people that really want to innovate and carry that same mission and continuously want to improve on whatever we've done before is so rewarding.
This is the promise of academic medicine. We train the doctors and conduct the research that improves lives here in the heart of our state and everywhere in the world. This is our commitment to Minnesota.
It starts with an individual patient, it starts with an individual doctor, but it grows. It becomes a community of patients and doctors and scientists at the University of Minnesota, and then it grows further to become a larger community. That is why we do what we do, because we can see that on the ground. It starts with this patient that you are looking at in the eyes and you want to cure. And so I think that's the power of academic medicine, is it starts with a small group of dedicated folks, and it really can translate to affecting patients around the world.
To make waves that improve lives here in the heart of our state and in the world, it starts with the patient.